So let's have a look at abdominal injuries. Now your abdominal cavity lies below your rib cage but above your pelvic cavity. But unlike your pelvis and unlike your rib areas, then the abdominal area doesn't have any bones to be able to protect it. And any injury to your abdominal region will cause serious damage to the internal organs, because different organs react in different ways when they're subjected to any kind of trauma. The internal organs that could be injured include your liver, your spleen, or your stomach. It can also be that there are injuries to the pelvic and also the abdominal region. Hollow organs, such as the bladder, they tend to rupture, releasing their contents into the surrounding space. Solid organs, like the liver, well, they tend to tear instead, and they have bleeding. This may well be quite slow and sometimes overlooked. Now, signs and symptoms of abdominal injury can include bruising, bleeding or an obvious injury, pain, maybe inability to stand up, they might be holding the injured area, or they might be feeling nauseous or vomiting. Now, treatment then is to place the patient in as comfortable position as possible so they can rest. You may need to help them to lie down, maybe on their back or even on the affected side, whatever's comfortable for them. Having their knees raised up will actually help to release the spasms of pain. Maybe ensure the clothing is loose, and support them maybe with pillows or blankets for warmth and comfort if needed. And of course, give them lots of reassurance. Now, if trauma has caused the victim's internal organs to protrude outside the body, then please don't touch them. Don't try and push them back in, as doing so will obviously cause greater pain and also more complications to that casualty. Instead, you're going to ask the person to lie flat with their knees bent and cover the organs with a moist sterile dressing composed of a material that doesn't stick to the affected organs. Do not allow the patient to eat or drink. Although they may be complaining about extreme hunger or thirst, don't give them anything to eat or drink, because obviously this person's going to need an operation, and give them something to eat or drink can cause further complications down the road. Finally, it's also important to get immediate medical attention as soon as possible. The job of the first aider is to stabilise the patient until professional help can come and take over from you. Don't forget to hit that subscribe button so you don't miss out on any of our important videos.